Good morning, everyone, and welcome to Social Venture Partners Dallas. Since the beginning of the pandemic, almost 1 year ago now, SVP has been hosting these sessions to respond to critical issues in our community. We are so grateful this morning to our panelists, the esteemed panelists that we have together this morning, for giving their time on a crazy Dallas day, a very cold day and a very unusual day. But we are very much used to that word now, unprecedented, as we are having another unprecedented weather event. And so particularly grateful to the sponsors who provide for these sessions. As you know, they are very expensive to produce, and so we are grateful to Something Good Consulting and to the law firm Wright Knatzer, and to all of you who offer your donations to help us bring this to our audience so that everyone can participate. For many who are without electricity today, the session, of course, is always recorded and will be in our library, which can be viewed through our website. So I'd like to introduce our panel. Their biographies are on our website, and we hope that you have had a chance to look at them. But I want to welcome Dr. Fred Cerise, who is with Parkland Hospital. He serves as the president and CEO of Parkland Healthcare System. Marion Brown, the Dallas sheriff, and we welcome her on what must be a very busy day for her department. And Dr. Eric Bing, who is professor of global health at SMU and an accomplished author and medical physician. So we welcome you all here to the panel today. Sheriff, I'm going to switch up a little bit and start with you. How's the situation in the county? What should our audience know about what's going on out there? How's everybody doing?
Well, we're taking it one day at a time in terms of our immediate situation here with the weather, but we're doing pretty good concerning our health situation over in our jails. And so we're pleased to have a good partner that we work with, that it being Parkland Hospital. We're pleased to work with them. And so we are managing our situation over there, and we're pleased about what is taking place there.
Thank you. Dr. Cerise, how's it going? How's the weather impacting the situation at Parkland? And we just got to get you on the mic there. If you can switch your mic on, that'd be great.
Okay, thanks, Tony. So, we're scaling back our operations quite a bit. A lot of elective stuff is being canceled. Our clinics, we're having to close just because staff has trouble getting in and out of places. We know patients are going to have trouble getting around town right now, and some of the buildings we're having power issues with and other things. And so our facilities team is very busy trying to keep the campus up and running, and we're doing our best to get staff into the hospital to take care of the people that we have here. All that being said, we've done okay over the past couple of days. We've slept a lot of people at the hospital. People have spent the night. We've turned our clinic into a dormitory, essentially, so that the people that we have here can stay here and be available for another shift. So we're juggling. Staffing is our biggest issue at the moment.
Dr. Cerise, I'm gonna stay with you and get into the heart of the matter for our conversation. Parkland is an iconic public health institution. There is enormous trust built up, despite some rough spots over Parkland's history. Your system does an amazing job, and we all owe you a debt of gratitude for the services that you have provided to those most in need in our community. Your system strives to meet the healthcare needs of the underinsured and the uninsured in Dallas County. If I have my numbers in order, you have close to 900 beds, which generally stay full, 75,000 discharges a year, over 1 million visits to your institution, deliver 13,000 newborns, and see 80 new people a day. Those numbers are staggering, and that was prior to the pandemic. Your team had to use some very innovative design strategies to shift units, procedures, and protocols to meet the demanding needs of COVID-19. Was there a pre-existing pandemic plan that you implemented, or were there changes made on the fly? What must be in place from your leadership, from a cultural perspective, to allow the great things to happen that you all have accomplished there?
Well, first, thanks for the comments, Tony. And it's an incredibly busy place. And one of the advantages of that is, you've got some scale so that if you need to adapt your operations and shift, you've got some pieces to work with there. And that's essentially what we've done. We do have emergency plans in place for things like weather events and disasters. And our emergency preparedness team does those tabletops. We've been through active planning and implementation around Ebola. So, and that was not something that you could necessarily predict, but our emergency planning team would sort of do their assessment and pull in the appropriate people and very quickly put a plan together. And that's kind of how we've approached COVID. We have a command center, emergency operations team that stands up at a time like that. We'll have an incident commander. We'll pull together a group of our operational engineers to start working on what needs to be addressed and when, and sequencing that out. I can remember getting a call from the county judge, on a Saturday or Sunday morning early on, and said they were going to be getting some federal support to do testing sites. And within a day, our operational engineers had set up the design for the American Airlines Center, which was the first testing site to be done. And so, our planners become implementers, our educators that traditionally are doing that role become testers or become vaccinators. And so we take the people we have and adapt their roles, and we've been able to, as we've shifted from some of the traditional work that we've done, patient volumes have actually come down in systems across the region, across the country. And with that capacity, we've redeployed people to either be testers or be vaccinators or, run new clinics that are set up to deal with this.
I appreciate that, and appreciate the leadership that allows for the kinds of innovations that you have made. Dr. Bing, I'm gonna ask you to chime in. One of the slogans that is often used in the philanthropic sector is "Think globally, act locally." A pandemic does not respect borders. What would you say are the number one, number two priorities we must do differently to avoid unnecessary loss of life? There are some estimates that with better leadership, there are at least 40% of those that have died in the United States would still be with us. What global perspective should we have had on this, and what do you think are the priorities going forward?
Thanks Tony for having me today. I couldn't agree more. Boundaries are an illusion, and we're totally connected, whether we would like to be so or not. And I think, if we sort of think about what is sort of most important in controlling this epidemic, I would probably say that the two things are science and solidarity. That we have to be basing our responses on science, and whether that is management science or behavioral science or the science of the virus itself. These are all interrelated, and we need to follow it. And then also very close partnerships and planning, just as we're doing here in Dallas. And I think part of our response and some of our successes that we've actually seen here locally is to a very science-based approach to our policies, as well as partnerships between multiple sectors.
Sheriff Brown, I'm going to ask you to follow up on that a little bit. First of all, level set for us what you are responsible for, because most folks in Dallas County probably don't think that you're running one of the second largest mental health facilities in the state and don't understand the magnitude of your role. Will you level set what you do and what's the day-to-day life of the sheriff of Dallas County?
Yes, indeed. Thank you for having me today. As you said, most folks don't understand what the role of the sheriff is, and the sheriff of the county in the state of Texas is responsible for taking care of individuals who have been charged with criminal offenses. And as you said, We are the second largest such facility in the state of Texas. And because we are the second largest, then it is not uncommon for us to be, if you will, the trendsetters in maintaining and taking care of the clients that are assigned to our custody. In the instance of COVID, we are so fortunate to have wonderful partners, that being Parkland Hospital, and we work together with them to make sure that the clients that are assigned to our custody are all kept safe. We are pleased that our situation is managed to the degree that less than 5%, of course, you don't want any cases, but when you have a setting where there are over 5,000 persons in one area, then you are going to have some situations. But we are pleased that our numbers have been maintaining below 5%. Again, thank you to our staff and to the staff from Parkland. And people have to understand that the sheriff, being in charge of the care and the custody of individuals, is also responsible to make sure that those individuals get medical, mental, and dental attention as necessary. And this is a daily operation. I often tell our people that I thank them for turning the wheel, because in my mind, it's like a wheel that has to be turned, and you have various spokes that fit into the wheel, and each spoke affects the work of the next spoke. And so if there is something that is going on with one spoke, then it can create a problem for the following spoke. So this is a day-to-day operation, and people need to understand that we make sure that people get daily medications. We make sure that people get to see their doctors, that they get to see their dentists. And we are pleased about the fact, because we are I don't know that there are any others in the country who are able to say that they have embedded in their detention facility a full-fledged hospital, which we do. It is managed by the professionals of Parkland Hospital. So anyone who goes to Parkland Hospital for treatment, if you are in our care, in our custody, in our control, then if you have an appointment, then you too get that same care that Parkland provides at its regular facility.
Thank you so much. Dr. Bing, you talked about that Dallas County has done a really decent and great job in terms of its leadership in managing it here for all of these issues. And I want to join that recognition. When you think about the global experience, and you think about your own experience and the lessons that you have learned from your work in other countries, how do you think we fare here in the United States? Are we doing what we could be doing? What should we think about locally that we could be doing better?
Okay. Thanks, Tony. I think if you sort of begin sort of looking at the U.S., there have been some successes and a number of areas where we really could have improved. And some of the best examples of what can and should be done has actually come from many smaller countries, and some of them are developing countries, who actually been very successful at having clear, consistent messages, of following the science of distancing, of contact tracing, of really mobilizing their communities. And if you think of where we need to be with COVID, it really is preventing these illnesses, not playing catch up as we treat them. And that's actually what other countries have been able to do, whether we're looking at New Zealand or Taiwan, South Korea, who've actually been quite successful at this. And I think that as we look into this new phase, hopefully we will begin to catch up. I think one thing that we have done well is Operation Warp Speed, this public-private partnership designed to get vaccines out. And that really is something that has not only, I think, stimulated the development of very fast response to vaccine development here in the United States, but also has stimulated development abroad. So I think we'll all benefit from that. But I think you're right. Leadership is actually critical. And I think this is where the U.S. Can greatly improve.
Dr. Cerise, I understand that obviously the distribution of vaccinations have been put on hold because of how bad the weather is. But I want to say, you know, if you can see my sticker that my wife and my daughter and I, my expectant daughter, all went through the Parkland system recently to get our vaccinations, and it was excellent, very well done in terms of where the distribution that we went to. So we appreciate your work there. But you once said that, you know, public health is really advocacy for the underdog. Our audience at Social Venture Partners are very engaged. They're citizens, they're philanthropists, they're business folks. They want to do the most effective thing and the most efficient thing possible. Talk to us a little bit about what our audience can do to help the efforts that Parkland is going through right now.
Yeah, well, you know, that is a lot of the work of Parkland and public health systems is trying to ensure kind of access to care for the entire population. You know, in our health system today, there is good access to care for probably about 80% of the population. And then it gets tougher when you start getting into the Medicaid, people on Medicaid and the uninsured, which is a big part of our business. Texas, as you know, has the highest uninsured rate in the country. We're not a Medicaid expansion state. We are fortunate in Dallas that we have a strong safety net, and we get a great deal of support from the Dallas community, both public support and philanthropic support. And so that allows us to do the kind of stuff, you know, the vaccine effort that we've been able to do, and the staff that we have that can turn that kind of thing on. And so, you know, a lot of times in the U.S., your access to healthcare is a factor of geography. And, you know, we have a high uninsured rate. We sort of make up for some of that with the safety net system. What could we do better? Obviously, we know the data show that more people that are insured have better health outcomes. They have better access to care. They have better outcomes when they do get sick. And there's a lot of studies that show that. And so the more we can do to get people coverage, the better. So Medicaid expansion is something that, you know, the state has considered over the years, and I know that'll be another topic of discussion in this coming legislative session. And it's got a lot of support from not only the healthcare sector, but the business sector. You know, businesses pay a premium for the uninsured in Texas that other states they don't pay, because it shows up as higher premiums in the employer-sponsored coverage side of the equation. And so Medicaid expansion would help. It would go. It would help sort of reduce some of the uncertainty in the funding streams that we see to do the work. Because as you referred to, you know, a lot of the way we patch together funding, we have county dollars, we have Medicare dollars, we have Medicaid dollars. Within Medicare and Medicaid particularly, those are subject to the whims of the state and federal legislatures. And, you know, decisions there can have a major impact on the operation here. And so anything we can do to help expand coverage is going to be beneficial. And then the other thing that we all deal with is behavioral health. And over the years, behavioral health has not had the support that we need. And that shows up in a big way in our system as well. And so support for behavioral health providers is going to help all of us as well.
Appreciate that. I understand that Parkland has a foundation that is established for folks to make contributions to and to get involved with. One of our own partners, Social Venture Partners, George Baldour, is on that board. Talk to us a little bit about the role of the Parkland Foundation.
The Parkland Foundation is an incredible organization. I've been in public hospitals for my entire career. I've been here at Parkland about 7 years now. I've never seen anything like it. The level of philanthropic support for a public health system in Dallas is greater than anything I've seen. It helped us to build the new facility that we're in right now. It helped us to build a breast center for women to, when we look at our data, we know women that present to Parkland with breast cancer disproportionately present with stage 3 and stage 4 breast cancer. We know if we catch that disease earlier, we're going to improve survival. Women on our foundation recognize that and went to work to support a campaign to expand and enhance our breast center. So later this month, we'll be opening a new breast center that was funded by the Parkland Foundation. And then just up and down the sort of spectrum of big needs like that, and then smaller targeted needs for women, our babies in the NICU, our burn center. The foundation has been incredibly supportive of the people that depend on Parkland for care.
That's excellent. Sheriff Brown, a similar question to you. How do philanthropists, how do volunteers, how do nonprofits engage with the work that you do?
Well, we have a community partnership that we utilize to assist us in reaching out to the community. And so we are always looking for opportunities to share with the community what it is that we do. Specifically, things like for the first 3 months of COVID, we work with the YMCA to provide discounted childcare to our first responders who had to continue to work. Also, we partnered with Thomas Jefferson High School and engaging some of their seniors to try to work with them to provide them with the tools to sustain their mental health, as well as building relationships with those in that age group. Also, we provided fresh produce to many of our employees who make a certain amount or don't make a certain amount, and we're still finding themselves in need. So we were able to provide some of those needs for them. So it's tremendous when we can have the philanthropic community help us out, particularly with our partnership. We appreciate the community when they help us.
One of the things at Social Venture Partners that we focus on a lot is trying to get folks out of their silos, that philanthropy, it can be in a silo, public dollars can be in a silo, the business community, et cetera. And when we cross those silos, we seem to do much better. And Dr. Bing, you wrote in your book, Pharmacy on a Bicycle, that the healthcare issues aren't so much as a result of not knowing what to do medically, but it's that healthcare does not utilize some basic business practices or entrepreneurial practices that could really help. Can you talk a little bit about that for us?
Yeah, and thanks for that, Tony. I think we tend to sort of think that medicine is about medications and healing, and it is all that. But in order to run these successfully, we really need to understand good business practices and run those. And many of the things that Dr. Shreeser just talked about really follows good business practices, making sure that things run well, that they are organized, and that there are incentives for both providers as well as businesses in order to serve people. I think that's absolutely really critical. And it's very similar to a lot of the work that we do at Southern Methodist University, where I work, where our research is very much focused on interdisciplinary research to help improve access to care.
Do you think that some of those things are even possible, though, with the regulations and the big money that is involved in the medical profession, particularly big pharma, that we would ever be able to really do the kinds of innovations that would allow for delivery of services to be much quicker and much less expensive in our communities? Do you see any of that happening?
Well, I think you can look at Operation Warp Speed that we have with the COVID vaccine as an example of that. Where the federal government has worked with pharmaceuticals to speed delivery of vaccines out there. I think it's these types of partnerships and these types of innovations that are quite successful. However, even within COVID, we also have other examples, such as with the development of the antibody tests, that where the federal government just allowed many people to come in, with many businesses to come in without a real strong safeguards. So I think it requires both engagement, it requires some safeguards, but it also you must sort of allow them to be creative and entrepreneurial to develop these different products.
Dr. Cerise, I read in the Dallas Morning News a couple of great articles that describe the kind of innovations and the quick responses that you all had to make to manage the COVID crisis in the hospital. But talk about it from a little bit from a leadership perspective. And then I want to ask Sheriff Brown the same question. There is a lot of very clear research that talks about how entrenched systems can be. Hospital systems, prison systems, government systems, and innovations and doing things differently can often be met with a lot of roadblocks, sometimes even unconscious ones. How do you manage through all of that, Dr. Cerise? How do you make the innovations work?
Well, I would say that people in healthcare, particularly people in a place like Parkland, want to do whatever they can to do the best job to serve the population as best we can, and recognize the challenge, many of the challenges that our patients face in getting access to care. So number one, you've got a group that's motivated and oftentimes motivated to address systemic problems with the healthcare system that make it difficult for people to get care, whether it's funding, whether it's access to care, because people are working, and if they can't get off of work, they lose their pay for the day. So that's a barrier, or transportation, or childcare, or there's just a lot of things that people are thinking about, that people that are taking care of patients recognize and would like to address. And so there's a kind of this milieu where you've got a motivated group already. And then the structure of our system, believe it or not, is such that it really does foster innovation, because we're not, you talked about the silos. We're a broad system that encompasses everything from primary preventive care in our clinics, to specialty care in our clinics, to hospital care, to post-acute nursing facility care. We've got an insurance plan on top of that. And so there's many pieces of that continuum that generally are siloed in our health sector today that exist under one umbrella. And then finally, because of the way that we're funded, 75% of our patients are either uninsured or on Medicaid, and that funding tends to be pretty flexible. And so the way we're funded also supports the ability to innovate, because we don't have to have a face-to-face visit in the office every time to get reimbursed for that encounter. And so we can think about, all right, how could we do this better, differently? And so I don't have to have a head, what we call in the business, heads in beds, people in the hospital bed to get paid. And so if there's a better way to do it, we will. So I'll give you one example. One of our infectious disease doctor years ago recognized that we had patients who were uninsured in the hospital for 4 to 6 weeks getting IV antibiotics for a complicated infection, a bone infection or infection on a heart valve. And they couldn't go home and do that like a patient on Medicare could do, where they'd go to an infusion center once a day and get an infusion, or have a home health nurse come to the house and do it. So she started teaching patients to deliver their own antibiotics, how to connect the line, hang it on a coat hanger on the wall, count the drops per minute. And now thousands of patients, 10 years and thousands of patients later, we've saved millions of dollars in hospital beds by teaching patients to give their own antibiotics at home. And so now they don't wait in the hospital for 6 weeks, but they go home and manage it themselves. So things like by being sort of almost forced to be creative in certain instances, it generates more innovation. And you asked Dr. Bing about other countries and how we compare to other countries. Certainly less resource countries, I think, figure some of this stuff out. A few years ago, I was at an orphanage in Guatemala that was taking care of kids with chronic renal failure, and they were all in the orphanage on peritoneal dialysis, getting dialyzed in their dorm room. We will now, later this month, open up our first peritoneal dialysis center, informed by what they're doing at an orphanage in Guatemala, because it's more convenient for patients, it's cheaper, and it's actually safer. And so our structure supports innovation. Our people want to look for ways to do things better. And so, my job is to kind of create some space for people to do that and support good ideas.
It takes a really well-informed, kind of mature leader to have a paradigm open to learning best practices, even from developing countries. And so when we have that paradigm that we can learn from others, Sheriff Brown, talk to me about how that works with the jail system. I know you have over 2,000 employees, I think, that you manage. You have folks in the worst possible situation, being closely confined during a pandemic. You've had to manage through some really difficult things. How does it work? Do you go around the country looking for new solutions, looking for innovations? Is it business as usual no matter what comes at you? How does it work as a leader in where you sit?
Well, from where I sit, we're always open to visiting with those who are in similar situations throughout the country to find out what works for them. And oftentimes I say, there's no need to reinvent the wheel. Sometimes, as Dr. Cerise was talking about, you can simply look at what someone else is doing and learn from what it is that they are doing. Of course, again, I go back to the Dallas County Sheriff's Department and the detention facility being the second largest in the state of Texas and the 9th largest in the United States, which places us in a position where it is often common for persons to contact us and say, hey, can you all kind of help us out with this situation? But by the same token, we like to look at what some of the smaller places are doing, because we get good information. We learn good lessons. As Dr. Cerise said, we learn good lessons from them as well. But when COVID came, this was something unprecedented for us. And so it was important for us to utilize sound judgment and basically common sense, and couple that with the medical direction from our partners at Parkland, and figure out how it is that we could best take care of the clients that we serve. One of the first things that we did was we stopped the in-person visitation, and we granted video visitation to everyone. And that was something that I have to admit that even some of my staff, had questions about, because we're required by the state to give visitation to our clients. It's important that they have that connection with their family and their loved ones. And having this information, knowing that that's a requirement, but still trying to look at how we can best curtail and manage the COVID crisis that we were embarking upon. One of the first things we did was we said, we're going to have to do it. And eventually, all 254 counties in the state of Texas were directed to follow suit. Again, this was nothing magical. There was nothing special. It was just common sense and stepping out and shifting our paradigms, what it is that we're accustomed to doing, what we know we're supposed to be doing, but how can we do it? How can we best do it such that we meet the needs of what it is we're trying to do? And so it's been a huge challenge for us. We've had to rethink things like recreation for our clients, as well as exercise, things of that nature. We've had to rethink all of these things. And so, again, it takes good leadership, but good leadership is about using common sense. I think it is, and sound judgment. And that's what we have been able to do. As Dr. Cerise said, we've had plans in the past because we've had Ebola, of course, in our facility. We've had plans to address and prevent tuberculosis, things of that nature. But when COVID came along, this was a new kind of animal for us, if you will, because we didn't know, and our partners, the medical professionals, they didn't know as well. That's why we were calling it novel. It was so new to us. We didn't know what the world we were dealing with. And so we had to just kind of step back and say, what is it that we are trying to do? And how is it that we can best do it and minimize the impact to our clients? And so again, that's where we are. That's where we are now.
And Tony, if I just add to that, I think that both what Dr. Cerise and Sheriff Brown are really sort of emphasizing is that crises occur, challenges are going to happen, and what is important is sort of what we do with this crisis. The opportunities for telemedicine or distance mentoring. All the things that we're now sort of looking at in healthcare, in law, in education, the capacity for that was already there. However, when the crisis occurred, it took strong leaders to sort of say, we have this opportunity, let's move it. For the past couple of years, I've been running a leadership program for school superintendents in rural Texas, Oklahoma, New Mexico, all the areas here in the Southwest. They have been very, very isolated. But by coming together, thinking about how they can get students the care, the education that they need, they've been able to come up also with sort of innovative things. So I think that the challenges that we experience nationally and globally, we're able to use that to push through some really innovative and creative solutions, which I believe will last once this crisis is over.
I appreciate that. And that's what I wanted to ask Dr. Cerise as well. And then back to the sheriff, to your point, Dr. Bing, do you think any of, the hope is that with a crisis like this, we have learned some lessons and we won't go back to business as usual. But Dr. Cerise, we have known for a long time that people of color in marginalized communities get healthcare services at a much less quality rate and much less access than do their white counterparts. And, the pandemic has simply highlighted that and shined a bright light on it that almost cannot be turned off. What changes were you all making in your thinking and in your delivery of services to meet those needs? What are you all working on?
So I'll mention a little bit about the vaccine and our approach to that, and then perhaps a little bit about telemedicine, and as Dr. Bing referenced. For vaccine distribution, what we've seen not only in Dallas but around the country is disproportionate uptake among white individuals, and a lower uptake among Hispanic and Blacks and other minority populations, and that's sort of you see that play out in healthcare in general. If you look at disparities and the inequities we see in the system, there's a lot of data on that, but also at times of crises. I heard Ezekiel Emanuel talk the other day. I was on a call, and he mentioned that you can see the discrimination that occurs just by the fact that when you put something out there to vaccine and come sign up, and you try to be sort of fair, and everybody can sign up on the website, who ends up, the people with more resources that are more facile, that can get on there and have strong networks. And so we saw 60% of the people on the county list early on were white individuals. And if you had a problem signing up, and your network or your kids would be able to do that. And so that in and of itself was kind of it was discriminatory, favoring a group that was more predisposed to be able to take advantage of that methodology. What we've been able to do is to apply some filters to those lists to try to be equitable in the distribution according to need. And that's the important thing is, we know if you look across the state of Texas, for instance, across the state, almost 50% of the deaths from COVID are among Hispanic population. Only about 15 to 16% of the vaccinations are among that group. And so that's the biggest disparity. You see a similar disparity for African Americans, but we've got a group that deals with data analytics and predictive analytics, and they're able to look at a population and see at baseline where the higher baseline risk exists based on social situations, based on baseline disease. It's called a social needs index, based on where you live and age, demographics, income, education, and then also prevalence of chronic disease can establish some underlying areas of higher baseline risk. And then on top of that, they layer what's called a proximity index. And that is who in that area, how many cases of COVID do you have that puts you at a higher risk of getting COVID? And then they will factor that along with the traditional risk factors of age and other chronic diseases to come up with a prioritization scheme that is more effective at identifying who's at greater risk of COVID. And then those are the ones that will get invited in sequentially for the vaccination. So we've been able to sort of modulate some of those, the baseline differences by applying these factors. And, the concern is if you do too much of that, you're going to slow down the process, and the emphasis is on getting the vaccine out quickly, which we certainly appreciate and understand. We think you can, by paying attention though, you can do both. You can be fast and you can be equitable at the same time. And so that's how we've approached the vaccine issue. Going forward, we have learned about what abilities we have to accelerate our work in telehealth. That clearly, again, for an underserved population is going to be a game changer, because if we can deliver care more conveniently, then we'll be able to do a better job of reaching populations in need. So I'll give you one quick example. Our obstetrics group has already identified that they could do at least a quarter of their prenatal visits by telephone, just by telephone, not even video. And as they've looked at their outcomes from their early experience, they know they can do it safely, and it's not having a negative impact on their deliveries. And so we'll be taking those lessons learned to see how we can improve our digital health footprint, not only from just a visit perspective, but also how we manage data for the sake of the population to improve health. So that's a digital strategy that goes way beyond just the video visit, but gets into predictive analytics and who needs more care, who can do with less care. But that work has certainly been greatly accelerated by the COVID experience.
Thank you, Sheriff Brown. You've had to deal with the pandemic as well as the racial reckoning since the murder of George Floyd and the issues against, that are saying criminal justice reform is so necessary. Are there any reforms that you all are thinking about that you have either implemented immediately? For instance, it is well written that the poor stay in jail longer because they can't post bond. And there are people, it would seem like in a pandemic, you would want as many people out as possible. How do you manage all of those things? And how have you done any kind of justice changes to meet the demands of the community?
You're right. Especially in these unprecedented times, we want as few people in our facilities as possible. In fact, at the onset of COVID-19, what I did was I sent a letter out to the 32 agencies in Dallas County and asked the heads of those law enforcement agencies if they would consider, before you bring someone to the facility here, we asked them if they would consider whether it was an offense that could be what we call cited and release, issue a citation and release them to answer for that charge at a later time rather than arresting them on scene. I sent that letter out and I asked them and encouraged them to also consider things about, does this person need to go to jail today? Is this going to prevent some crime from happening today? What is the nature of their charge? I asked the leaders of the agencies, and I could rightly ask them because they knew that I come from municipal law enforcement background and that I have had the experience in terms of dealing with persons when you're working out on the streets. So I could say to them, I understand that sometimes you have to do what you have to do, but I'm going to ask you if you would to encourage your officers to use their best judgment before they arrest persons and bring them down to our facility. So you're right about that. We asked them if they would help us in that effort, and I'm proud to say that they have been working really well with us in this effort. Our numbers have fluctuated in terms of our population. Some of those numbers are related to the cessation of some court proceedings here in the midst of the pandemic. And so we continue to try to work with our partners throughout the whole spectrum of the community in lessening our numbers and keeping our numbers down and getting people out when we can get people out, because you're right. We don't want people in the facility during this time. We really want to be able to work with our criminal justice partners and still accomplish what our end goal is. In terms of reform in law enforcement, yes, we heard that cry, and we too took it seriously, and we reevaluated many of our policies. You know, you've heard a lot about the duty to intervene. Well, many agencies, and I'm proud to say that our agency is one of those, already had that policy. It was not called a duty to intervene policy, but it specifically stated that officers are responsible for one another. You know, here at the Sheriff's Department, we have what we call our core values, and that is integrity, professionalism, and accountability. To me, that accountability piece is extremely important. And that, I think, helps you when you're serving the community, because if the community sees that you as an agency are serious about accountability within your agency, then they are more apt to trust you. And this is why this is so important for not only the Sheriff's Department, but for policing as a whole. This is why we're having people saying, well, we need to defund the police. And I don't think that they really want to be without police service. What I think people want us to reevaluate how we police. I think people want us to take a step back and look at how we can better be accountable for our actions. I think people want us, especially those of us in the head positions, those in the leadership positions, they want us to ensure to them, the community that we serve, that we are going to hold our people accountable. And so we at the department, it's known throughout our department here. You're right. We have some 2,100 employees, and they all know if you walk up to them and you say, what does IPA mean? And they can tell you that it means integrity, professionalism, and accountability, because it's not something that we just plaster on the walls. It's something that we live. It is what is expected of us from our community. And it is of utmost importance that we remember that we have been charged with a huge responsibility. I tell them all the time, to whom much is given, much is required. And that means that we have to give accountability for our actions. So we continue on a day-to-day effort to be accountable to the community, to reach out to the community. You know, here at the Dallas Sheriff's Department, community relations was not a huge thing. If anything at all, it is to us now, because again, that's my background. I believe that it is important for you to partner with the community, not just say, well, we're the police and you're not the police. You have to work together with the community to make a better community. And that's what we endeavor to do here at the Sheriff's Department.
I appreciate that and appreciate your leadership and your service. Dr. Bing, I want to ask you this question because in addition to your perspective on your expertise on global health, you also do a lot of work in leadership development. And for many leaders, one of the things that we stumble on, and most of the folks on this, we have a definition that a leader is anyone who has a following, right? And so, what do leaders do to change these entrenched biases that are in systems that we are, whether it's healthcare, criminal justice? How do you talk to your own groups of leaders about how they think differently about these kinds of things?
One of the things I think that is important for all leaders to have are peers or others who think differently than them, who can challenge their set of assumptions and their beliefs and stimulate them to go beyond where they have gone up to this point. You made a comment before that COVID has shown us disparities that can't be ignored. But those disparities were ignored. They've been ignored for a long time. And so leaders don't have to do anything about it. But I think what this has created is we have many more people who are talking about it, who are moving forward. I think some of the unrest that we had last year has also helped accentuate this. And I think that the other thing is that an infectious disease shows that if anybody is at risk, we are all at risk. And a leader who understands that and then who can move forward is really what we need today.
I'm going to stick with you for one more second and to go back to something that Dr. Cerise said, where he said they're using analytics and data to start delivering services to more critically, to the needs, where the needs are greatest. But, when we have a culture that is saying, facts don't matter, and now you're saying, that leaders have all these facts at their disposal and they have perhaps should be engaged with peers who think differently about them. How do you counteract this whole paradigm that facts don't matter?
Well, I think what is most important is that outcomes matter. And I think that is really going to be the bedrock of what we do. When we are using data, we can get better outcomes, we can save more lives. And ultimately, that will actually be, I think, the thing that drives us. We're actually quite fortunate in North Texas that we have lots of technology companies, partnerships that are already there. Some of the work that Dr. Cerise talked about is predictive analytics that's happening, so we can really target interventions for specific populations. At SMU, we're also doing work in virtual reality, in using technology to train people to perform different medical procedures, to engage in new ways. And these are ways that will help us not only transform healthcare here in the United States and in Texas, but really all over the world.
I really appreciate that point, that it is outcomes that matter. Dr. Cerise, in the last few minutes, and I'm going to ask each of the panelists to respond to this. We have just a few minutes left, but personally, how have you been changed by the events of the last year?
I would say that disasters, they bring out the best and the worst in people, and mostly you see the best. You just see a lot of good that happens. And so I can remember, I can remember I was in the Superdome for 3 days after Katrina. And after the second day, I was sitting on a dock and I had a call from the command center that was in Baton Rouge. And they said, the help is going to be coming the next day because today the roads are all clogged with people pulling their boats to go down there to get people off their roofs. And I just remember getting emotional and just thinking, people are good and people show up and they help. And we've seen a lot of that in COVID, the response, people looking for how they can pitch in and make it better. And so it really is, it kind of fills your bucket for the work that you're doing, to know so many people are trying to do the right thing.
Dr. Cerise, thank you for being with us, and please know that the community owes you a debt of gratitude for your fine leadership and the work that all of the staff at Parkland do for us on a daily basis. Sheriff Brown, how have you been changed by this?
Well, this is caused me to, I think it's Dr. Bing who said, what affects one affects all. And it caused me to realize that in seeing about people who are charged to my care, then I was in essence seeing about the community as a whole, because those people have loved ones, they have family members, as do the persons who work in those facilities. They have loved ones, they have family members. And so if we're caring and attending to and seeing about those persons charged to our care, then we're also caring about the whole community. And so it caused me to stop and again rethink how we do some things and why we do some things, and to think outside of the box, to try to find some different ways of doing things. It doesn't always have to be, well, that's because that's how we've always done it. It's made me think outside of the box in many instances.
You know, when we see you show up at things, we are grateful for your service, but we don't often think of you as the CEO of a major company, and we don't often think of you as a deliverer of healthcare and mental health services. And so for all of the things that you represent, we appreciate the service that you are doing as well for our community. Dr. Bing, how have you been changed in the last year?
I think one of the things that this past year has really sort of emphasized to me, and this is not necessarily a change, but certainly a greater appreciation that really it is often the simple things that matter most and have the biggest impact. And we're looking at things that are just not rocket science, like the importance of collaboration, the importance of science, the importance of facts and truth. These things can't be overemphasized. And when we have them, we can save lives. When we have them, we can be much greater than we are today.
Dr. Bing, I thank you for saying yes to our panel, for the work that you're doing in leadership around these efforts, for the great minds that you are shaping through your work at SMU. Thank you for being with us. You know, I want to go back to the basic kind of belief that Dr. Cerise said, that people are good. At Social Venture Partners, we have a slogan that all we see is potential. And so we invite the audience to join in our work at Social Venture Partners. If you want to get engaged with us in what we do in the community, please visit our website. We would be glad to have your support. I want to once again thank our panelists so much for not only joining us today, but for the incredible work that you do on behalf of the citizens of Dallas County and behalf of all the citizens of our community. I want to thank our partners, the staff. I want to give a shout out, Sheriff Brown, to Jasmine Carter, who helped me pull this session together. She works in your department.
She's outstanding.
She was a resident at Dana Jewett, one of our programs for young professionals, and I'm delighted for her leadership and to see her rise in the community as well. Thank you to my team for pulling this off as usual with no electricity and all the kinds of things that everybody's facing. We really value the work of all involved. So stay safe, stay warm. Let us know how we can help you, and join us and visit our website at Social Venture Partners. Thank you.
Thank you.
Thank you, Tony. Appreciate what you do.
Thank you.